Hello, and welcome to HIV Community Link's training on PrEP, pre-exposure prophylaxis, basics and eligibility. In this video, we will provide an overview of what PrEP is and why it is important to have PrEP in the response to the HIV epidemic in Canada. This training will cover basic information for health and social service providers. If you would like to get a detailed presentation, please feel free to request an in-person one either at your workplace or in our office. We will go over who is eligible for PrEP and give you some strategies to provide education, counseling, and support to people who could be a potential candidate. It is important to remember that PrEP is just for the prevention of HIV. What we have after almost 40 years of HIV knowledge is HIV prevention requires a combination of prevention strategies that includes biomedical, behavioral, and system-level interventions. This combination decreases the risk of HIV transmission. There is no one-size-fits-all. Not one prevention strategy is effective for everyone. Therefore, we require a number of prevention strategies, and the outcomes are even better when those strategies are combined. One strategy in our HIV prevention toolbox is pre-exposure prophylaxis. PrEP is a prevention technology that involves the use of antiretrovirals, or in other words, anti-HIV medication to lower the risk of acquiring HIV. Major studies have shown the importance of taking PrEP correctly in order to effectively prevent the acquisition of HIV. According to these results, the effectiveness of PrEP is increased significantly when people took the medication the right way and consistently. PrEP has been in use for the last 8 years. The Food and Drug Administration in the United States approved PrEP in 2012. Following that, Health Canada approved PrEP in 2016. Since then, Canadians have been using PrEP for the prevention of HIV. In October 2018, the Government of Alberta made PrEP available to Albertans at risk of HIV free of cost. This eliminated the burden of out-of-pocket costs for the people who needed it most. Around the world, more than 80 countries have implemented programs for PrEP as HIV prevention. A number of scientific studies conducted around the world have shown that PrEP works if taken correctly and consistently. The United Nations Organization on HIV and AIDS is a supporter of PrEP. They have set a goal to achieve no new transmission, no discrimination, and no AIDS-related deaths by 2030. The use of PrEP as a prevention strategy is one step towards that goal. PrEP has shown to be effective among men, women, and trans individuals. It reduces the sexual transmission for both vaginal and anal sex. There have been studies about the effectiveness of PrEP in people who inject substances, and the results of those studies have been promising. In Canada, despite numerous preventative efforts, the number of new HIV cases are staggeringly high. Most of those new HIV diagnoses are reported in what we call key population groups. Guys who are into guys in Canada are at 131 times increased risk. People who use substances are at 60 times increased risk. People from endemic countries are at 6 times. And our Indigenous community members are at 2 to 3 times a higher risk of HIV. So, who is eligible for PrEP? In 2018, the Alberta PrEP Working Group solidified the eligibility criteria for PrEP. According to these PrEP guidelines, the population groups eligible for PrEP are men who have sex with men, trans women, and gender-diverse people. There are some additional specific eligibility conditions that are assessed by your provider on a case-by-case basis. The individual risk for HIV transmission can be assessed based on their sexual activity, STI status, and their partner's HIV status, to name a few. PrEP can also be recommended to heterosexual people based on their partner's HIV status or risk of HIV. It is also recommended for people who inject substances. The eligibility risk is a reference to practitioners who prescribe PrEP. However, the individual risk of HIV is assessed by your medical doctor or nurse practitioner. Thank you for joining us on our first video about PrEP. You can follow HIV Community Link on Facebook, Twitter, Instagram, or LinkedIn.